Good afternoon, everybody. Thank you very much for joining us. In the next 45 minutes, I'm gonna share with you my experience with minimally invasive RF procedures and how to grow in aesthetic practice. And this is the time also to thank the organizers for inviting me and letting me share with you my experience. So let's get started. So just a few words about myself. My name is Lehavit. I am a dermatologist. I've been practicing regular dermatology and aesthetic dermatology for the past 15 years. And actually, I conduct almost all the treatments that are possible to perform without surgery in the aesthetic arena. So let me tell you something which I have just recently found because I have turned 50. Aging is nothing to write home about. It's not fun. And I also think that everyone today wants a younger look. But I think to myself sometimes, did we take it just a tiny step too far? Well, I think that we did. And maybe this is the reason that we see a real shift in approach for aesthetic treatments in the past few years. We're not talking only about filling wrinkles and restoring volume. Today, we are talking about rejuvenation, texture improvement, and most importantly, natural and harmonious results, or what I call natural beauty. But let's talk just a few minutes about the aging process. So we know age affects the skin. As you can see on the left side of the slide, a younger skin as opposed to an older skin. So what happens to our skin as we age can be divided roughly into two categories. We lose volume, but yes, we also lose the skin's texture and quality, and we have to address those two issues if we want to perform good skin rejuvenation. But as we age, it's definitely not only about skin, because we know that aging is a multifactorial process that involves all layers of the skin, from the most superficial to the deeper structure of the skin or the face. So all different layers of the face are involved. As you can see here, the artist, the German artist, drawn his mother, and you can see the young mother versus an aged mother. So we know that we're getting older, but we also know that we can treat that and we want to become younger. But unfortunately, getting younger is not that easy. But first of all, we need to understand what is that our patients are looking for. Well, I think that my patient, when they come to my clinic, they don't want to change. They do not want to become anything different, but they want to see a better version of themselves. Because we also know today that the biggest barrier for aesthetic treatments is that patients are afraid to look bizarre. They are right, because we see a lot of freaks around. I think that when we're treating patients, close your eyes just for 1 second and listen to the harmony that Mozart created. That's what I'm looking to create when I'm treating my patients. And that's why we have a lot of treatment targets that we need to follow. This is not a one-night stand. This is a long relationship. We need to create a treatment plan if we want natural result. But let me ask you something. Aging is a natural process. So every anti-aging interference should yield something unnatural? Well, the answer is definitely no. But we need to stick and to keep up with few basic rules. And if we want to just narrow it down, it's all about the correct proportion and all about the correct combination. What do I mean when I'm talking about correct proportion? We know that we see a change in the structure of the face over time. In the beginning, when we are young, the face is narrow at the bottom and wide at the mid face. And this is the opposite as we age. And moreover, each one has a specific ideal proportion for its own face. There is no same template for everyone. And we need to keep that because we know that correct proportion is timeless, as you can see here. We have to keep up with the same rules of proportion because take a look what happens when you have the correct proportion on the left side and just slight change in proportion on the right hand side changes the whole thing. And the second rule is combination. I really like combination. I've been talking about combinations for years now. Why do we need combination? Well, everyone wants the same. We all want the same, but the needs are unique, are different. As I have told you, each patient is like an art creation, no same template for everybody. Another reason to combine, because we can tailor the exact suit that our patient needs because of the skin quality, the skin condition, the money that they have to invest. And another reason to combine is we can do better treatments, achieve better results with less downtime and less pain. But there is another reason to combine. I know that we're doctors, we do not like to talk about money, but we have to because we conduct a business, not only a clinic. So another reason for combination is it helps our clinics grow. We have to see if we can treat a wide variety of patients and we want to give them packages. If we can tailor different needs for the same patient, we give the patient better results, we give the clinic more income, and we don't have to look for new clients. And why do we need to combine? Because take a look at the list of what our patients are looking for. We have a lot of targets to treat. Our patients have a lot of demands. We cannot achieve and treat all demands only with one solution. We need to offer them combination in order to give them the better treatments. So to conduct combinations, do we need so many devices? Because the market is flooded with a lot of devices. And I tell you what my husband asks me every time I buy a new device, do you really need so many devices? So the answer is yes, I do need a lot of devices. We do need different devices because if we want to deliver what we call the holistic approach and give our patient the holistic solution, we cannot do that by using one technology only. So you can see what treatment options we had in the past and present. And as I told you, everything today is about combination. So why do we need energy-based devices for skin rejuvenation? Why do not use only fillers or botulinum toxin? Because energy-based devices globally addresses the patient demand. And this is exactly the holistic approach. But the market is flooded with so many devices. Which to buy? So first of all, you need to look at what are the needs of my patients today and what are the future needs that I want to offer my patient. When I have started my clinic around 16 years ago, I had only botulinum toxin and fillers and electrocoagulation. And then I bought one device. I bought a platform because I wanted to extend the treatment options that I can give to my patients. And then I bought another device. We do not buy all devices together. We take it step by step. But every time we need to think, what are the patient's needs currently? What are the future needs? How do I want to grow my income of patients? If I want to give my patients more treatment options, or I want to attract new patients into my clinic. And in the beginning, I like to buy one device that can treat few indications. And of course, it needs to be safe, because safety is above everything, and it has to be with proven efficacy. So that's bring me straight on to the EndyMed Pro platform. So let me introduce you to the EndyMed Pro, which I have been working with for the past 5 years with great success. So this is a platform, and I really like platforms because you buy one device and you can give your patients a lot of different solutions to different problems. And every patient come to your clinic bothers with one thing, but immediately the day after, he has something else that bothers him. That's the way we are. We take care of one thing and then we see another thing. So you can see here the different handpieces of the EndyMed Pro, and we will go over step by step over the whole handpieces. So just small introduction to RF, because the EndyMed Pro is an RF-based technology. So we know that RF is a part of the electromagnetic spectrum, and the frequency of RF device is important, and it is inversely proportional to the depth of penetration. So as you can see, RF is a non-ablative method that produces resistance within the various layers of the skin. The tissue resistance can cause an electrical current which transforms into thermal energy. Once we hit, we trigger collagen production, we trigger the fat cells, we trigger whatever we want. It depends on how deep the RF current enters, and what is the temperature, what is the thermal energy. So we have a lot of methods of RF energy delivery, as you can see here in the slide in front of you. Of course, we have the monopolar, we have the bipolar, unipolar, but we also have the 3-dip technology. The EndyMed's 3-dip technology, this is a patented technology. So as I told you, we have a lot of RF devices out there in the market. So what's so special, what's so unique about this device, about this patent? So the 3-dip is patented for its multi-source. We have 6 generators acting at the same phase, thus manipulating the RF current to be pushed deeper into the skin. So the advantages, we have deep, controlled energy, minimal flow to the skin. So it means the epidermis is cooler and the deep surface is heated more. So we have safe and effective treatment with no side effects. So we have 6 generators acting together. So the heat is focused and controlled. So because the RF current is pushed deep into the skin, the dermis temperature is high, is 52 degrees. So if we have deep heating, we trigger a lot of collagen stimulation. But the epidermis remains at 42 degrees. The epidermis is cooler, so it means safer and less painful. So that's the biggest advantages, in my opinion, of this technology. And I have been working with a lot of RF devices for the past few years, and I really, really like this platform. Okay, so the 3-dip, again, the simultaneous multiple electrical field created by the multiple sources attract each other, leading actually to three-dimensional delivery of RF energy to the dermal and subdermal targets. So we hit both the dermis and the hypodermis, and we can achieve that in a very effective and safe manner. Thus, the treatment is both effective, safe, and not painful. And take a look at this slide. You can see here a regular bipolar RF technology, and you can see on the right the 3D. You can see that we have a vertical flow up to 6 millimeter penetration into the skin. So we hit deep in the dermis and hypodermis, which will help us target both the dermis and the hypodermis, depends on the indication, but the epidermis is cooler and unharmed. You can see here, you can see in the top picture, the fat layer, and the blue strips are the collagen strips, which blend. We have collagen also in the hypodermis, and in the lower picture you can see a real-time thermal image in which the heat reaches up to the hypodermis and actually targets the hypodermis and the collagen deep in the skin, which will result in skin tightening, circumference reduction, and better looking skin. So just to conclude, what's so unique about the 3D technology is the only RF technology that utilizes the 6 generators which works together. We have safe and effective heat of the dermis and the hypodermis, and of course this is an FDA approved technology. So let's talk a little bit about the different clinical application. First of all, the indication. We have indication for the face and indication for the body. We can treat wrinkles, we can treat skin laxity, we can also treat scars and acne scars. I will shortly show you my results. And of course, we can also treat body. So the same device can treat face and bodies for wide range of indication. So this is the first handpiece which I like. It's called the iFine, specially designed for the delicate area of the eyes, penetrates only 1.5 millimeters into the skin. As you can see, the treatment is safe, is painless, no downtime, no burn. You just keep moving the handpiece over the whole area that is treated, and I think this gives you a really good result. You can also combine it with other treatment options. The second handpiece is the small handpiece. This is a bigger handpiece. As you can see, it penetrates 4 millimeters into the skin, and you can treat with that the cheek, the neck, the décolleté, also delicate areas. When we're talking about neck and décolleté, we really have to be careful. We cannot use something very aggressive. So that's why this handpiece is perfect for those areas. And again, it penetrates deep into the skin. The advantages of this platform, of this pattern of RF, is the safe penetration of the heat deep into the skin. Now, this is one of my favorite handpieces. You know, in every platform, you have a lot of handpieces, and yes, I like them all because they're all my sons, but some I like just a little bit more. And the Mini Shaper is one of my favorite handpieces. Why? Because it treats one of my biggest problems, which is the jawline. I use this handpiece mainly to treat the jawline. It penetrates 7 millimeters into the skin. You can also treat with that handpiece the arms, that we have a lot of problems, and also a lot of other areas. So this is definitely one of my favorite handpieces of the face. So just a little bit about the protocol, which is quite simple. We clean the face, we apply the gel, we set up the parameters, and then we just start moving slowly, not too fast, not too slowly. We don't want to stay without moving, because then we can burn the skin. We just need always to keep slowly moving. So the first 2 passes are the preheating. Then we do another 6 to 8 passes to get to the therapeutic zone. And the number of treatments is usually between 6 to 8, depends or on the patient, depends on the skin condition, and depends on everything. Usually, the intervals of the treatment is 1 to 2 weeks. Let's move to the body. So here we have a very nice handpiece, which is called the shaper. You can see that it penetrates 11 millimeters into the face. It covers a larger area as opposed to the face handpieces. And you can treat the abdomen, the flanks, the thighs. And this is a very unique handpiece, which is called the contour. So first of all, it's large. It is good for large areas such as thighs, abdomen, flanks, and it penetrates up to 50 millimeters into the skin. But it is not only RF. It has the 3D patented RF and accompanied by a pulsed vacuum. So you have deep heating, we have a creation of new collagen, we target the fat cells, so also we have vacuum, so it penetrates deeper into the skin. So the protocol of the body, first of all, again, it's really similar to the protocol of the face. We do 2 to 3 passes just to get preheating, but then we do around 12 to 15 passes to get to the therapeutic temperature, and we need around 8 treatments to see good result. What it will give us? It will improve cellulite, circumference reduction, and skin laxity. It can target all those 3 different indications. Another really nice handpiece of this device, as a matter of fact, this is the handpiece which I like the most, I have to be honest with you, is the fractional handpiece. So when we're talking about fractional handpieces of RF, we have the intensive and the FSR. And let me level with you. I have been working with RF devices, with fractional ablative RF devices for many years. But this device is unique because it's very effective, but the downtime is 0, is totally 0. So if we're talking about an ablative procedure, I can offer my patients CO2 procedure because I have 2 CO2 devices. I can offer the erbium procedure, but the advantage of the intensive is that it yields an amazing result even for difficult deep indication such as deep wrinkles and deep acne scars, but the downtime is 0, no PAH, no side effects, and that's, I think, is the best handpiece of the device. So when we're talking about ablative device handpieces, we have 2 in this device, which is the intensive and the FSR. You can see here the indication. You can treat almost a lot of indication with it. My favorite indications are wrinkles and acne scars and surgical scars. Of course, you can also do skin tightening, and you can treat other indications I will show you shortly. So this is the intensive handpiece. It has non-insulated needles. It's RF and microneedling. They penetrate up to 5 millimeters into the skin. The penetration is smooth. It's less painful than other microneedling devices. Believe me, I have some experience with other devices. And you can see this is 25 microneedles and it penetrates up to 5 millimeters. Now, when we're talking about intensive, mainly we target the deeper structures of the skin, as opposed to the FSR, larger spot size, but more ablative. So if we want to treat more superficial indication, like to create a superficial peel, but we don't want to use something very aggressive, and we don't want to use chemical peel, we can use this handpiece. You can see that it creates both ablation and a little bit of coagulation. The penetration is more superficial as opposed to the intensive, And we use this handpiece if we want to perform a peel-like procedure. You can see here the histology after one spike of RF. So you see the deeper penetration into the dermis. And here you can see the fast healing. I told you this procedure is almost zero downtime. Believe me, in the beginning, I couldn't believe my eyes. I thought that something I did wrong because I was used when I'm using RF when I'm using ablative fractional RF, there is a downtime of 3 days. Here, the downtime is zero. So this is an amazing treatment for patients who don't like any staying at home, any healing time. So the advantages of this device, of this handpiece, which is called the intensive, this is fractional ablative RF with microneedling, so the treatment is comfortable and there is hardly any downtime. And of course, you can also use this to perform drug delivery. I will shortly show you my result using the microchannels that are created to push into the skin cosmeceutical or active substances. So take a look at this procedure. This is the intensive procedure. This is my secretary. We are treating her for the melasma. So again, this is the combination of the 3 deep energy, as we talked about before, the simultaneous 6 electrodes, and we have the microneedling. And you see, if you take a close look, this is the patient's skin type 4. There is no bleeding. You can see that the treatment is not painful because she sat with topical anesthesia for about 45 minutes, and the healing is really, really short, really, really fast. So if you want to sum up the advantages of the intensive, we have smoothing the insertion into the skin, so we can deliver the heat deep into the skin. The epidermis is untouched. We don't deliver any heat into the epidermis. The treatment is relatively painless if you sit with topical anesthesia for about 45 minutes, and the downtime is zero. So the treatment yields almost no PIH. That's why I like this handpiece so much. So here you can see some clinical pictures. Immediately after, we have a little bit of redness. So usually I put some calming cream, not something very active, not with steroids. And you can see 24 hours later, the patient is free and can continue with his regular routine. And as opposed to that, you can take a look at the FSR. So you can see that when we're talking about the FSR, the downtime is prolonged. So please take that into consideration. Yes, the treatment is more superficial, but because we have more ablation to the epidermis, we have to rejuvenate the epidermis, so the healing time takes longer time. The healing time is around 5 days, 5 to 6 days. And you can see here the histology of the FSR as opposed to the intensive that I showed you before. So the penetration is more superficial. So when we're talking about FSR, we're talking about superficial indications, sun damage, and so on. When we're talking about intensive, we're talking about deeper structures, deeper wrinkles, skin laxity. We're talking about ice pick scars, and so on. So you can see here, wound healing after FSR, so it takes longer time. So we have around 1 week downtime when we're talking about FSR. So what's the treatment protocol? Of course, we clean the skin, we apply topical anesthesia. I let my patient sit for about 45 minutes. Then we perform the treatment. I do few passes. Usually I don't count the number of passes. Usually I look at the patient and I want to see the end result, which is a little bit of erythema, not too much, but I want to see. So usually I do around 3 to 4 passes, and then I put some soothing cream and of course sun avoidance. Usually I perform 3 to 4 session treatments, monthly interval. You want to see some results? Because I want to show you my results. So this is a small study that we have conducted recently using intensive and tranexamic acid for patients with melasma and hyperpigmentation issues. You can see here the protocol. So this is how we perform the treatment. First of all, we do a few passes with the intensive. We penetrate only 1.5 millimeters into the skin. Why use the intensive and not use the FSR? Because when we're talking about melasma, we don't want any inflammation. So I just want to create a tiny microchannel, and through that microchannel, I will insert my active product. So now my active product is hexacapron. We have a lot of references that backs up. This is a well-known protocol using the microneedling RF and hexacapron. And take a look at our results. So this is the patient before and after. You can see melasma and sun damage, and take a look at the improvements. You can see here both the clinical and you can see here that she has very nice results. And this is another patient. She has a little bit of everything. She has a little bit of confluent erythema. She has a little bit of melasma and sun damage. And again, we used a special device, which is called the quantifier, to analyze for us the result. So take a look at the clinical picture, and now take a look at the model that the device created. You can see a reduction, substantial reduction in the hyperpigmentation, both clinically and in the diagram. Again, very nice improvement. Take a look that also the erythema has improved significantly, and of course, the overall texture of the skin looks a lot better. And this is another patient with the same protocol. We use the intensive, low parameters, penetration rate only 1.5 millimeters into the skin. Again, this patient has sun damage, a little bit of melasma, a little bit of reduction in the skin quality. And take a look, very nice improvement even in the wrinkles. And you can see also in the model, in the 3D model, that we have really nice improvement. We can also use the FSR handpiece to treat patients with melasma. Here I used the FSR, of course, very, very low parameters and Jessner solution. So first, we don't have the perfect solution for melasma because melasma is a chronic ongoing situation. So if you want to really solve melasma, we cannot. And this needs to be a chronic ongoing treatment. So first of all, we need to improve, and then we need to maintain. So the improvement we can do with the EndyMed Pro, either with the FSR or with the intensive. Personally, I think the intensive gives us better results, but you can also use the FSR, especially for patients for a sun damage. And again, my favorite handpiece, the intensive. And here I used cosmeceuticals, a mesotherapy to push it into the skin to improve my result. This is a good option treatment for patients with acne scars. Again, usually those patients are young. They do not wish for any downtime. Usually for this kind of acne scars, mainly ice pick scars, we need a lot of sessions. Here, this is after 3 sessions only. So the intensive is really an amazing option for this patient. Of course, we can combine it also with other technologies, for example, non-ablative technologies, skin rejuvenation, and older patients with a lot of wrinkles. Maybe she would be a good candidate for CO2 resurfacing, but she doesn't want to stay at home for 1 week. And when she's doing my treatments with the intensive, she doesn't have any downtime. You come to the clinic, you sit 45 minutes with topical anesthesia, I perform the treatment, and then boom, you can continue with your regular routine. You get good results. A patient with acne scars and a reduction in the skin quality and textures, she's 50, she's an amazing candidate for this kind of treatment, intensive, and in combination with methodotherapy, which was not injected, of course, but pushed into the skin after we performed those microchannels. Scars. I think the scars is an amazing indication to treat with the intensive. You can see here my protocol, again, once a month, around 3 sessions. Take a look at this amazing result. And this is not a rare result which we achieve. The trick about surgical scars is starting the treatment early. As soon as the scar heals, we start the treatment. So around 2 months after the surgery, boom, we start the treatment. Then we ride on the natural healing process and we make it better. So we don't have to start the process from zero, because in the scar, after 2 months, there is already a new collagen production. But when we perform after 2 months an RF procedure with intensive, for example, we increase the collagen production, we increase this wave of wound healing. So this is a really nice indication. We have a lot of patients with scars, with traumatic scars, surgical scars, and so on. And this is an amazing niche, and this is an amazing treatment option. As I told you before, acne scars, again, this is the same protocol. We treat young patients, darker skin types. We need to take into consideration PIH and downtime. Those patients need a series of treatments. Even if you use CO2 procedure, you need multiple sessions. So if you're offering a patient multiple sessions, it might as well be with less risk for side effect and with less downtime. And believe me, I saw a lot of PIH. You can also believe me that I've been working with ablative RF technologies for many, many years. And I definitely think that RF is by far my favorite ablative technology. And again, I have also CO2 and I have erbium and I have all the other ablative technology, but RF is effective and less aggressive and less downtime. You can also use it to treat skin laxity, as you can see here. Of course, you can also combine this treatment with the non-ablative handpieces of the body, for example, the shape or the contour. Another indication which we can treat is hyperhidrosis. We know that axillary hyperhidrosis is a really common indication. Those patients really cannot function. You hear the same story from each patient. So yes, we can give them a treatment with a botulinum toxin, which is a good treatment, but the problem is that you need to repeat it every 6 to 10 months. It depends on the patient, so you need a repetitive treatment. So treatment with intensives yields you good results, as you can see here. You can see here the protocol at the bottom of the slide, and only 3 sessions, and you get prolonged result. So this must be a good treatment options, patients with axillary hyperhidrosis. Again, the patient needs to sit with topical anesthesia for about 45 minutes and even a little bit more. This might be a little bit painful. Downtime is 0, no side effects, and again, really nice result. Stretch marks. Regarding stretch marks, there isn't any perfect solution. Stretch marks as melasma is a very tough indication. Usually the way I treat stretch marks is with combination. You can see here in the slide in front of you. So you can see here a combination of the intensive and IPL. Of course, you do the IPL and then the intensive. You can also do it only performing the FSR. If you have stretch marks and skin laxity, you can also use the non-ablated handpiece, the shape or the contour, and then immediately followed by the FSR. And again, stretch marks, good result with the intensive. You can also combine it with other technologies. Sometimes I like to combine stretch marks with ablative RF, such as the intensive. But before that, I really like to do something non-ablative, such as a erbium glass or fractional non-ablative 1064. Alopecia. Alopecia is a common indication, especially in women. We can also use this to treat alopecia. We can use it to treat wrinkles, and of course to contour cellulite. We can use both contour and intensive. First we use the contour, and then immediately followed by the intensive. The contour penetrates deep into the hypodermis also, and you can get very nice result with this combination. So just before we end, just before I say goodbye, let's talk about the business side. So we have a lot of indications in the market. You can see here that these are the top indications in the market. So the idea is to buy one platform that will give you an answer, a solution for many indications as we can. So the EndyMed platform will give you the solution for skin laxity, for wrinkles, for skin texture and quality, but also for acne and acne scars. This is one of my favorite treatment mode for acne scars, the intensive. So you can buy one platform, you can and you can use it for different indications. And again, remember, the idea is to buy a platform that you will blend into your clinic needs and enables you to make the same patient come for more treatments. Yes, she came for Botox treatments, but you can offer her also body contouring treatment, or she came to improve the nasolabial fold, but you can improve her jawline. So you can use and treat the same patients more and more, and you can make them come into your clinic more often. And again, keep remembering that the goal is to create a treatment plan. I really think it's not only business, but this is the correct way to achieve good and natural results. And how you combine? You can combine the EndyMed almost with everything and anything. So why to buy EndyMed? Because it's safe, because it's effective, because it's comfortable, and because we can use it for a wide range of indication. So I really thank you for your attention.